name is Greg Kaiser, and this is Think Supersystemic. We explore the science, art, and economy of interconnectedness. Today, our discussion is with Dr. Monnica T. Williams, clinical psychologist and professor at University of Ottawa. Dr. Williams focuses on African American mental health, culture, and psychopathology. Her current projects are focused on developing assessments of race-based trauma and better understanding how to identify and address mental health disparities. Hi, Dr. Williams. Welcome to Think Supersystemic.
Hi, thank you. Thanks for having me.
You're welcome. Thanks so much for agreeing to be on the show. Before we get started, I just wanted to say, given the kind of the race situation today, I didn't want to start off without saying a bit about that. Somehow I don't have words for it, but it's so unfortunate what's happening. The other factor that I have to acknowledge is that it's been happening for a very long time, and we're just suddenly getting good video and recordings of this stuff. So, it's really, it's unfathomable that we let this go for so long. The other part that really distresses me now, because I'm really seeing it, is there are a lot of people who won't acknowledge that there's a systemic problem. And that it's been going on for a long time and are resisting it, perhaps because of their own biases and racism and so forth. But I am excited about what Black Lives Matters has accomplished, and it's really promising that the conversation is being elevated. And I'm especially excited also about the work that you're doing. That as you know, I kind of came across it 6 months ago when I was planning the conference. So I'm really excited to talk to you about that today.
Yeah, thanks so much. Yeah, it's really unfortunate. What's going on? Like you said, it's been going on forever. But one thing I do think is different is it does seem like people are now more willing, to acknowledge that Black people have been oppressed, and more people are, I think, embracing the need for anti-racism efforts, mm-hmm. which does feel a little different to me, and I hope that it translates into real change.
Yeah, hopefully we'll see some police reform and so forth. But yeah, I would love to get a little bit more into that toward the end of the conversation about what anti-racism efforts you think could have the most impact. But before we get there, I would love to hear from you, just kind of get an overview of your work, over the last 10 to 15 years. I know you've been at several universities and stuff, but where your work has started and where it takes you to now, and kind of the breadth of things that you're working on related to race.
Yeah, sure. So my original interest, the reason I went to graduate school in psychology, was because I was interested in OCD, which I know probably doesn't seem related at all to the current topics that we're talking about. But that was my interest, and I studied OCD when I was in graduate school, and I was shown a really interesting study that indicated that some of the gold standard measures for OCD were not valid or effective when used with Black people. So that kind of left me scratching my head, like, well, so we might be missing a lot of important things if the measures we're using that we're all assuming are gold standards aren't effective for people of color. So I started to investigate that a little bit more. And so I got really interested in race and racism and the mental health of communities of color. And I remember asking my advisor at the time if maybe I could study racism. And he kind of scratched his head and said, I don't think you can really study that. And I said, okay. So I just kept studying OCD. But then later on, after I graduated, I discovered that you actually can study racism, and there are validated measures for understanding and quantifying racism. And in fact, there's been a number of years, in recent years, where we've been studying the impact of racism on mental health. And that research is really, I think, now we've got 20 years of good research that's really sort of ironclad in terms of making the connection between racism and all kinds of mental and physical health problems. So this is become my main interest now and the focus of my work.
Okay. Could you
Yeah.
could you tell me, for example, what is an example of a measure that you would use to kind of assess whether or not somebody's negatively impacted by racism?
Sure. So there aren't really a lot of measures, but there are a few. There are a couple of measures of microaggressions specifically. So
Hmm.
microaggressions being sort of covert, everyday kinds of racism that people experience,
Hmm.
usually in interactions. And so there is a scale that asks people specifically, like how often do you experience this kind of microaggression, or this one,
Hmm.
or this one. And then other measures of general ethnic discrimination that look at frequency and how much stress these events cause. And then
Hmm.
also my own research team, we've developed some new measures specifically around trauma, where there's been a huge gap, because most measures of trauma, checklists of common traumas, don't include anything on those checklists related to racism.
Hmm.
So a lot of clinicians are assessing PTSD and they're asking people about traumatic experiences, but they're not asking about their experiences of racism.
Hmm. Okay, and so your work now is to develop the way to assess and measure where somebody falls on that kind of scale of being impacted by racism, right?
Correct, correct.
Okay.
And I do enjoy psychometrics, but that isn't really that's not the end point of my work. What I really want to do is develop interventions and treatments for these things, but
Hmm.
we can't develop the interventions until we have a way of measuring it, because
Hmm.
we have to know how bad was it when you started the intervention, then after the intervention, did it improve? And so
Hmm.
until we can reliably measure it, we're a little bit dead.
Okay. And so is the ultimate goal that, I know you're also focused on mental health disparities. Is that all the ultimate goal is to develop kind of this practice associated with treating racism and to get it into communities and so forth that are underserved?
That's one of many goals.
Okay.
One of many goals. I mean, even better than treating people who've experienced racism is, can we prevent the racism in the first place? So
Hmm.
I don't think it should all be on people of color to find a way to recover and heal from it, when what
Sure.
we really need to do is find ways to get people to stop doing it.
Yeah. And do you have any, can you share a little bit about, do you have any ideas on that front now? I mean, I think seems to me that a lot of it is perpetrated by people who are not even willing to acknowledge that racism is a problem, right? And so can you talk a little bit about that
Right.
part? Yeah.
Yeah, I mean, certainly, there are people out there who, are very openly and proudly racist. But this isn't really the main problem. Certainly, those
Mm,
people are a problem,
yeah.
and those people need some help. But
Hmm.
but most of the problem is by people who think they're well-meaning,
Mm,
but are continuing to perpetrate racism in their daily interactions with
hmm.
people of color, without necessarily even being consciously aware of it.
Hmm.
And so the first step is awareness. People, you can't really change behavior until you're aware of it. And so I
Hmm.
think right now we're seeing a big push for increased awareness with anti-racism trainings and so forth. I think that's a critical first step. And then after people are more aware, then we can sort of start to critically assess their behaviors and start to intervene in that way. And so I think people need to really take stock of what they do and why, um, in order to think about how they can align their behaviors
Mm.
more in sync with their values.
Interesting. Right. Okay. That's very interesting. I'm really, it seems like in addition to it seems like Black Lives Matter specifically should help with that to an extent, right? I mean, because if you're a well-meaning person and you think you're not a racist, but actually you have these underlying things that you do to people on the side or in meetings or in whatever, then it should be, hopefully become more into your conscious mind at this moment. I would hope. Um,
Yeah, I mean, I would hope so too. But this has been going on. I mean, we've had the
yeah.
most recent spate uh, uh, you know, of heightened public awareness over the last 2 weeks or
Hmm.
so, maybe 2.5 weeks. But you have to remember that this is a lifetime of ingrained patterns, and you're
Yeah.
not going to change that in 2.5 weeks. So
Yeah.
it has to be an ongoing effort on the part of people with anti-racist values and people who want to be allies. It has to
Yeah.
be an ongoing effort,
Yeah.
because you have to untrain yourself from whatever 20, 30, 40 years of
Yeah.
BS that you digested uncritically, and
Yeah.
then continue to swim upstream and fight the ongoing barrage
Yeah.
of, of BS
Yeah.
that we're still all subject to.
Yeah. Got it. Yeah, I guess in retrospect, the two things that we heard of recently, Christian Cooper in the park in Central Park, and then the fellow in LA, where the woman comes up and assumes that he doesn't live at the house. Those two situations, I guess neither of those individuals probably would have considered themselves to be racist or have been identified as such, right?
Right, correct. They, and and people are really good at, when being called out on their racism, coming up with another reason.
Mm,
So,
yeah.
um, and so this is sort of, this defensiveness that you have to be able to get through to people.
Hmm. Got it. Okay, so I understand that you're also focused on finding treatments, and one of the treatments that you've identified as potential is MDMA. Is that correct?
Correct. So, MDMA has a lot of really wonderful properties for helping people who've been traumatized. It's
Hmm.
in addition to the psychedelic experience, and what we believe that it causes neuroplasticity or even neurogenesis, is the fact that it has these wonderful heart opening properties.
Mm,
And when you've been traumatized, particularly if it's an interpersonal trauma, the interpersonal piece is an area that really needs repair,
mm.
and also you need trust in order to work with your therapist or facilitator, to move through it. So I think MDMA is a wonderful option. That being said, I have seen other psychedelics
Hmm.
also show themselves to be effective for racial trauma as well.
Okay.
At my clinic in Connecticut, we've been doing ketamine assisted therapy,
Okay.
and we've seen some really great results with racial trauma too.
Okay. And so you've been actually treating people with these substances, right? Is that correct?
Yeah,
Okay.
correct. Although for MDMA, we only treated one person before we had to close our study at the
Oh,
University of
really?
so,
Okay.
so I can't say as much about that. Although the one person we did treat, he did extremely well.
Okay.
Um,
And
but
how many
but we've
people
been
have been treated with ketamine?
Yeah, so we've treated several people now with ketamine. I mean, we really only started in November, so we don't have like dozens and dozens yet. But the few we have treated for racial
Okay.
trauma have been very, very well.
Okay. And I understand, I'm somewhat familiar with the research around psychedelics, and I know that's, being used for PTSD, depression, addictions, and so forth. And these seem like they're likely kind of disorders that go along with racial trauma. Is that correct? And is there does that research tell us much about how these things might be used for racial trauma?
Yes, because racial trauma, it's very close to PTSD. I mean, many of
Yeah.
us who study it really don't see much of a difference
Mm,
between racial trauma and PTSD. It's just like PTSD caused by racism.
yeah.
And then also many people who have problems with things like substance abuse or depression or anxiety, it's because of past traumas. So I think that these all are connected, and that if we see good results with getting treated with psychedelics for these other problems, we have a lot of good reason to think they'll be effective for racial trauma too.
Okay. And do you see if things start to, as the um, FDA and other organizations, DEA, kind of loosen the lockdown on these substances, do you think that you'll be able to start studying some of those as well? Maybe psilocybin, the compound from magic mushrooms?
Yeah, absolutely. In fact, we're looking into a microdosing study of psilocybin for racial trauma right now. So I'm hoping that we'll be able to get that off the ground. But yeah, absolutely. We're looking at all avenues. I was even speaking with somebody today that was interested in doing a study of mescaline for racial trauma. So we're busy working really hard behind the scenes to try to get some of these trials going.
Oh, cool.
Yeah,
What is
and
that? Yeah, sorry, go ahead.
go ahead. Oh, well, in the meantime, we've also done a naturalistic study, a survey study of hundreds of people of color in the US and Canada, asking about if they've used psychedelics to cope with racial trauma, and how it might have helped them. And
Mm,
so we're analyzing that data now. Actually, we just finished a paper, me and my research team on this. I've been working with Dr. Alan Davis on it, and we just submitted a manuscript for publication where we found that that people that basically psychedelics were able to lead to great improvements in racial trauma in people of color who tried them for coping.
Is there any upcoming studies or interest in kind of combining people of color and white people together that might be in a tense situation or something, and use psychedelics in that way to kind of mediate?
I haven't heard of that, but I think it's an interesting idea, and I have actually been thinking a lot about maybe doing some anti-racism group work with psychedelics. I would love to do that. I think it could be very effective.
Okay, very cool. And so back to the kind of the community level. So you work in a clinic in Connecticut, right? Can you talk a little bit about the clients you see and so forth? Like, just try to humanize the demographics of the individuals that are coming into your office and that are affected by racial trauma, and you have like firm data on individuals and the damage it does.
Oh yes, so much, so many people. I would say there's two main reasons we end up seeing people in our clinic for racial trauma. One is because they've experienced ongoing racial trauma in the workplace, and the other is because of violence from law enforcement. So those are the two main groups of people. And generally, people of color, most of us are very resilient and we'll put up with a lot. But people in these work experiences, often they're coming to us because they've endured so much that they're at the breaking point and they can't endure anymore.
Okay.
And so they're usually in pretty bad shape when we see them, unfortunately.
Okay.
And then for many who've been involved with law enforcement, sometimes they've reached their breaking point. I'm thinking about a gentleman who was constantly pulled over and searched by police in his community. Even to the point where one time in the rain, he was strip searched and had all of his stuff taken out of his car and dumped on a pile in the street, and just sat there while they picked through every little thing, couldn't find anything as usual. And one time where he was even strip searched in public and cavity searched for no reason other than he was a Black man. And so one day he was traveling, he was an engineer traveling on business, and he got stopped at customs, and they went through all of his stuff and they dumped it everywhere and they left it in a pile. And he was just at his breaking point, and he said, "Put that back in my bag for me." And the guard said no, and he slapped the guard.
Oh, Jesus.
And so you can imagine what happened after that. He was tackled by many more, and then and then the law came down on him so hard, and and his lawyer's like, "Why did you do this?" And and they needed a psychologist to evaluate him and explain how he had gotten to that point where this was just the last straw for him.
Yeah. And was that used in court in any way to kind of help his case, and did it help?
Yes, absolutely. So we did a report and, really kind of explained that basically he had been traumatized by law enforcement doing this to him over and over again. And he got to his breaking point, and then he reacted out and lashed out that way. So, so I've done a number of reports like this for the court. Most of these have been basically young Black men who've been pulled over by police who were threatening toward them, and then they panicked and sped away. So every case that I've done, at least all the ones I know the outcomes of, these reports have helped tremendously.
Oh, great.
Yeah, and so it's been nice to be able to do that kind of work.
Great. And is there any movement nationally too? Because it sounds like, I imagine every day there are thousands of people in this situation. Is there, and they lack the legal support or the kind of help that you're providing. Is there any kind of national movement to get this kind of support?
Unfortunately, no. Most people who have these things happen to them end up really having the book thrown at them. And it's only either been because people have been well-resourced that they could seek me out, or the legal team just happened to be in the know and had the resources to reach out and get these evaluations. Because if they're incarcerated or if they're facing charges, they often can't leave the state. So I have to go there. And, and it gets expensive to fly out to a maximum security prison in Arizona, and do the work. So So fortunately, in these cases, there have been resources to support that.
Yeah.
But for people without means or without, without any representation that is willing to go the extra
Yeah.
mile, people just end up in jail.
Mm. And then the cycle continues.
Exactly.
So sad.
Exactly. It is
Um,
very.
yeah. So now back to the psychedelics thing a little bit. With the current decriminalization, it seems like magic mushrooms, for example, being decriminalized in a couple different cities and so forth. How do you feel about that? Like, and how, does it seem like, maybe a community-based kind of use of these substances could arise, and for them to be used in a kind of safe and helpful way? Or do you think there are some risks associated with decriminalization, and specifically communities of color?
So my answer is yes and yes.
Okay.
Both are true. I think absolutely communities can come up with ways of using these substances in a safe and beneficial way. And I mean, we already see that happening in places like Oakland,
Mm-hmm.
where substances have been decriminalized. There are spiritual groups that have training in using these substances to help people and have been doing it well. At the same time, yes, there's absolutely risks. I mean, these are powerful substances. And anytime you have a powerful substance, there's also a big potential for harm as well. And
Okay.
so I think it is very important that people have, experienced facilitators and guides working with them, when they start using the substances
Mm-hmm.
to make sure that they're safe and they're benefiting from it.
Mm.
And at the same time, it's really important that that guides and facilitators also have done their own work and are aware of issues like racism, because for a lot of people, when they use the substances, these issues come up around racial trauma.
Mm.
And you want to make sure that whoever is working with you can respond to that in a beneficial, helpful way, and not in a way that's going to compound trauma.
Okay. Okay. Thank you. That's very helpful. All right. Well, this conversation has been super interesting. I would love to maybe we can wrap up. Can you share maybe one or two resources? So if somebody is working with communities of color or in these situations, what they could where they could look possibly for help, not necessarily just for understanding psychedelics, but just understanding this way of framing the conversation about race-based trauma, and there actually being methods to kind of address it.
Yeah, absolutely. Well, so for one, my clinic in Connecticut, the Behavioral Wellness Clinic in Tallinn, Connecticut, we specialize, in racial trauma, and also we do great deal with psychedelics. So we're a resource. And then also there are a number of books. I wrote a book last year called Eliminating Race-Based Mental Health Disparities. That's just got lots of great information on how to work with communities of color and what some of the issues are. And then also I have a book coming out in a few weeks called Managing Microaggressions, which is
Okay.
also for mainly for therapists and other types of clinicians and healers who want to really learn how to make sure that that number one, they're not committing microaggressions against their clients, but also that they can help their clients when clients are suffering as a result of racism in the form of microaggressions. So those are some resources that I can definitely recommend, that I know they're good because I wrote them.
Okay.
But there are a lot of other people doing great work in this too. And certainly Dr. Gomez Diaz has written some great stuff on racial trauma that the people should check out.
Okay, awesome. So I'll put links to that stuff in the video.
Sounds good.
Yeah, but thanks again for being on the show. I really appreciate it. I mean, this work is fascinating to me. Clearly, we need to take your work and replicate it 100,000 times across the country.
Thank you for having me.
All right, thank you.